Hi there, this is Jodi Springer. It's October 30th, 2024 to overview a practicum for our Nurse 674 class at Grand Canyon University. The location that the practicum was conducted at was a clinical setting in Evernorth Care Group in Phoenix, Arizona. This care group has a total of 18 locations, and this particular one was called Stapley. This is an ambulatory setting that has family practice, specialties such as podiatry and vision, along with an urgent care and an in-home lab and an in-home pharmacy as well. The preceptor for this practicum was Kelly Arthur. She's been with the organization for 7 years and has been a clinical site supervisor at Stapley since 2022. Prior to that, her experience at Evernorth was the triage nurse at that same location. As you can see here, she is at a marathon at Disney representing Evernorth and a MS program. Now, what we did when we conducted is a needs assessment at Stapley. We had an assessment and a gaps analysis to identify what areas we could improve on or work for a project. I did work closely with our clinical informatics team. As you can see here, we had 6 categories that we were reviewing, such as scheduling. Is there a way that we can improve our scheduling time or offering to our patients? We focused on triage. How is that triage response to those patients and maintenance of there? The third one was the annual exam time. We did primarily focus on the annual exam, other than the office visit. We did also review In-Basket, which is the EHR messaging system. We're asking staff about encounters. How are they feeling about their encounter management, which is any interaction with or about that patient. We did also ask in regards to nurse visits. Are we actually conducting as much as we can to keep in that high scope of our nurse license? And as you can see here, our 2 main pathways here in the middle is annual exam time and In-Basket. How can we fix this? How can we improve on both of those areas? And it was determined that we were going to be doing what's called pre-physical labs. Pre-physical labs is utilizing the registered nurse to improve the time management for patients and for our providers. Now, how did this happen? How is this occurring now? It has been implemented, and we are going to be offering pre-physical labs to those patients that are established 18 years and over for a Stapley location. This will be an offering, and we will be having the front office send that information back to the registered nurse, where in the EHR system, there was actually a template built that is pulling in all of that clinical data about that patient, such as problem lists, medications, history, family history. And it's identifying and using kind of like an AI system to essentially prop up the most ordered labs for that particular type of patient. And then that registered nurse is going to associate those labs to the specific problems from their existing problem list. Now, they're not signing off of it, but they're kind of creating like a shopping cart for that provider. And then they send that message back to the provider. So we have now a patient that's going to have their labs done before the visit. During the visit, they can actually talk about their lab results and how they're going to manage that patient moving forward medically. And it's also decreasing that research time of that provider deciding what labs to order. Our goals, again, were to decrease annual exam appointment length time, decrease provider time in their In-Basket. We are using that registered nurse license to the highest of our scope. We are improving our patient satisfaction. Our overall outcome was wonderful. We have great responses from patients. We have improved time bandwidth for our providers. We have increased our lab results obtainment. We're actually getting more labs done in a timely manner. And we are improving patient care and overall health management. As I said, we're having that conversation with that patient in person. They could ask more questions to the provider rather than just a message, perhaps through a patient portal or someone that's non-clinical. And it's really shown an improvement of overall patient care. Now, we had some stakeholders here. We had our executive sponsor, Dr. B. Dr. Bardwaja is our wonderful executive sponsorship here. We had our primary sponsor, Stuart. He is a kind of a newer operations director for this organization. We have that preceptor, our wonderful Kelly Arthur. And then we did also pull in some back office and front office subject matter experts from Stapley to help with this workflow development. Now, I am pleased to say that all of our stakeholder categories have been sensational, supportive, and they are happy with the outcome thus far. Now, let's talk about sustainability. Okay, so sustainability is approximately at 100% for the rest of Q4 of 2024. That is exciting news. We are continuing. That's our goal. Now, come to Q1 of 2025, that may decrease to 75%. It's been identified that some of our locations will be pulling out that in-lab location, and those patients will have to now have the requisition faxed to a vendor, or they can go to one of our other locations, which we know, right, will be dependent on the patient, but also those locations and offering those labs for that patient. So after that, we are going to be continuing that 75% of sustainability for this project. My personal professional goals is obviously I'm obtaining my master's in nursing of leadership. I'm excited to be wrapping this up. I am then going to be continuing the program. I have signed up for a dual master's program where I'm going to continue on for my MBA. My goal is to become a clinical operations leader for a large health organization. I want to keep that servant leadership. Kelly Arthur was a perfect example of that. I appreciated her so much, how much she cared for her patients, her staff, and she really had empathy, but yet held that accountability for everybody. We want to improve staff satisfaction. That's my goal, is to improve that area, and also our staff and patient satisfaction. And then overall, enhance patient care and health. Now, I saw that in my practicum. Hopefully, I can bring that with many more projects or workflow optimizations that we see in the future once I do become that leadership role. Now, my learning achievements from this is ability to manage staff in that servant leadership style, listen to my staff in an open conversation and open-minded forum, right? I want to have that open door policy with them. I'm going to work closely with the leadership and how to navigate through that change management. We are also working with education and implementation on communication. Now, we did all of this during our practicum. I'm going to continue it. The nice thing about the practicum that I never have done was I developed a standard operating procedure from scratch. So I basically kind of created a tip sheet, put it into a nice forum, worked with the policy and steering committees to get this approved, and it was approved. Now, I do have a reference guide of our pro side. And again, this was Jodi Springer wrapping up my practicum. Thank you very much. Have a great day.